So turn your hand up, there we go, then in and up. Like a J. There you go.
I feel right.
Just on this side of here.
1, 2, 3, 4.
Oh, it's going up.
You want me to like have it?
Newborns aren't born with any rhythm.
I don't even know if I'm dilated yet.
We're about to find out.
Like it was the first time, do you remember? Can I take you there?
Good morning. Welcome back to my channel. Today is the day. And if you want to play a drinking game, take a shot every time I say it's all happening, because today's the day. It's all happening. I said that on the last vlog. They're like, take a shot every time Scheana says it's all happening. But it is, guys.
I was just thinking the same thing,
Really
actually.
is.
I was in my head, I was like, she's gonna lead off if it's all happening. I wonder how many times does she say it's all happening? Must be a life motto or something. Maybe she likes that saying, or maybe she has it tattooed on or something.
Now they're going to be drunk already. It's early.
That's funny.
Oh, so we are headed to the hospital. Brock got our last minute most important things we needed in the car, the placenta kit, the cord blood.
Well, we're catching our breath, but before we bring you along with the journey, apparently I'm going on vacation. We're gonna rock up and check into our room. We'll be checking in with 2, checking out 3.
1. It's all happening. My backpack.
We have enough for a vacation, okay?
It looks like we're going back to Hawaii with as many bags as we have.
She has a roller bag that just has a blanket and her pillow in it though.
And my breast pump. And
You guys saw it?
it's a nursing pillow also in there. Yeah, they saw it. You know, I want it to be over-prepared and overpacked, because you can never have too much, but you cannot have enough, and you can forget things. I'm sure I won't use 85% of what I brought. I was like going back over last night, like, did I bring this? I brought that, I'm probably not gonna use that, probably not gonna use that, probably won't wear that. But I have it all in case I need it. Oh, I can see the hospital in front of me. Wow. Okay. I'm not gonna say it again yet, but you'll probably hear it again in this vlog. It's all happening. Cedar Sinai, we're moving in.
Ridiculous.
First baby. We'll learn for the second. Jancan is now Jancan.
Okay. And then Shay is what?
My ex-husband's last name.
Oh, okay.
You put a ring on it so I can change it, honey.
Oh well. It's okay, it's just a name for now.
Literally, honey.
That's pretty good.
Honey will be the new last name.
Mm-hmm.
Like,
Apparently, somebody needs to spray wrinkle spray on her night garment, just so there's no wrinkles.
I just wanted to tell my
On her night garment. Were you trying to... Unnecessary. And now you want to get changed? Okay. Oh, there she is. Make your bed over here.
Okay, so we are all hooked up to everything. I had a little bit of a scare. They said that her heart rate was dipping and I freaked out, but I guess I just needed some water, and looks like she's doing good now. So it's gonna be a long day. They said prepare for about 24 hours. So we're in this for the long haul, which I was planning on. It was kind of the only plan I had, was it's probably gonna take a while. But everything looks good now. I was allowed to have a couple of snacks before I get this medicine I need. And yeah. Dad, anything to add?
You'll be right, baby.
Thanks. All right, we'll be back. Update, the Cervidil is in. That has to stay in for about 12 hours because I'm still not dilated. And we'll go from there. Mom's gonna come later. She was gonna come this morning, but nothing's gonna happen for a long time. So thankfully we got a good movie on. How to Lose a Guy in 10 Days is on. Brock's probably watching Wicked Tuna.
Maybe get to relax for a bit.
Yeah.
Nice futon bed.
What you doing, Dad?
Playing doctor. So, we're having points where baby's heart rate is dropping below having dips, is what they called it. But the problem with it is there's no like pattern to it. So, what they think it could be, and it's very common, first off was just having a weaker blood. We had no water in your system this morning. Did that, now she spiked up to like 140, between 120 and 150, well in between there. But then she'll like move and pinch her umbilical cord, and then you'll see it drop down, and her blood pressure will drop down. So, or her heart rate, sorry, will drop down. So, all in all, slow and steady is going to get us there, to the end today. Baby's going to come sooner or later rather than sooner. And we're just going to take it easy. We're in full control of this phase of the pregnancy. So what we've given you is it's called a
Cervidil.
Cervidil. Yeah, we kind of call it just like the server. You know, it's just going to serve you and help us take you to the next part of the pregnancy. So it's going to be a slow, enjoyable pregnancy. We're in control, so anytime you want to feel like you want to have an epidural, you feel like the cramps get too much, we can handle it, okay? So, but just sit back, relax. It's going to be about 12 hours. Let this medicine do its thing. We'll keep you on the fluids, and we'll keep monitoring you. And if anything goes wrong, we're not the only ones here. You are connected to the big screen with all of us inside, the nurses. And we'll be able to hear it, and then if anything happens, and with this, you might, maybe, if we have these dips, you might get a surge of about 12 doctors and nurses in here. Don't ask questions, they're just going to try and move you around, just to make sure baby gets this, so don't freak out, okay? Just expect that, it's very common during this part of what we're dealing with, you know? Just taking care of the baby, you're doing everything correct, mama, you're doing great, you're doing great. Right, that one?
Thank you. He's a very good listener.
Listening's easy, honey.
Yeah.
Yeah, you just
No,
gotta
I listen. I just forget after.
No. It's the one thing that humans can do very, very well, and that's fucking listen. It doesn't ask much of you. It just asks the skill you learned from birth. Just do that one thing correctly, and you'll be fine.
Yeah. I also just realized it's Oscar Sunday. The Oscars are usually in February. It's end of April, and now the Oscars are on TV tonight. And they look much different this year than last year. I'm going to pop up a picture of us last year at the Oscars and
Right.
how it started.
We are going
How it's going.
We are going to end up. One goal of mine is to end up at the Elton John after party.
Hell yeah.
That's fucking going to happen. I don't know how, but I'm going to make that happen.
We can
for
go
us.
to it virtual tonight.
No, this is in person. We are going. I don't know how we're going to get there, but mark my words, there will be a vlog. Maybe actually, we're not vlogging.
I don't think we'd be allowed to vlog the Elton John party.
Well then, fuck. It will happen.
It'll all happen.
It's all happening.
Shot. It is now, what time? 3:44 p.m. Nothing has happened since
Cramping.
3:44 a.m. when we left the house. It's been like 12 hours.
Yeah.
had a little bit of cramps right now, but then I realized I just had to pee and they kind of went away. So my doctor came in, checked me, still closed. It's just gonna be a waiting game, but she should be here tomorrow. How are we looking over there,
Well,
Dr. Brock?
Seeing pretty good. Just gonna put him back in the drawer. She's doing good. Guys, great little patient.
Good.
Yeah.
Oh, and the doctor said I could eat. They told me I couldn't eat, so I ate so much this morning, but now they said I could eat, so
What would you like, my love?
I don't know. What are my options?
I don't know. Vlog update. We have help. We got Mom. What's going on, honey? Not Grandma.
He just does that. Nana.
Grandma Nana over in the corner has come to help today.
Well, no, she would be Grandma Erica. It's not Grandma Nana. It's Brock. It's Brock.
Oh yeah. Tell us up.
Yeah.
Tell us, honey. What's going on?
Well, my what is this? My contraction monitor.
It's because your EDUI 80.
Anyway, it was a little too high, so it wasn't monitoring anything, but still chilling. It's now 6:32,
It just picked up a contraction.
and yeah, we've been here since 4 a.m. and nothing's really happened.
We are going on 14 hours, honey.
14.
Yeah, but not like 14 hours in labor.
Correct.
We've been chilling for 14
Chilling.
hours.
I've been chilling over there. If you didn't see on social, right here, photo of that.
Yeah, Brock just asked, is this what it's like to be in prison? Yeah, honey. To have people checking in on you, bringing you snacks.
Well, I think you
the
forget.
Oscars.
Okay, time out. No one's checked in on me. I've checked in on you. No one's brought me snacks. I've brought you snacks.
I brought you snacks. I brought snacks.
So, we're good. Doctor told me off for pushing a button on this thing when it was going off. Remember that?
Yeah.
Yeah, I got in trouble for that one. Don't play doctor in a hospital. They don't like that.
Well, they weren't coming.
Yeah, what happened?
It was, well, the alarm started going off. When
Well, this bag was empty. So
Yeah,
this
it
bag
was
was
the-
empty.
10 minutes that he left to take a phone call, the alarm starts going off. I'm freaking out. I think her heart rate stopped. So I called them. I didn't know what it was. It was just a doo-doo-doo-doo-doo-doo-doo. And I was like, the alarm's going off. They weren't coming, and I freaked out.
They have all of those monitors at the nurse's station.
So I
Yeah,
said,
but I didn't understand why they weren't coming.
Well, babe, they have other patients, and
But I
if
thought
it's
her
just
heart stopped.
if her heart stopped, you'd have 10 people
That's
in
what
here.
they said, and the 10 people weren't here.
just me.
Because if it might be, then it's fine.
Playing doctor. Bring in the snacks. All right, so that's it.
So this Cervidil's about to come out, and then a balloon might go in.
We're gonna go from this to
How
1
many
centimeter.
inches, honey?
Yeah, he said inches, no
1 inch.
centimeters.
1 centimeter, honey.
Would like to get her to 10.
The balloon will come out. We'll get you to 1 to 3. Then the balloon will come out. Then we'll give you the Pitocin, and we're away we go. Well done on those contractions. You just had another one actually over here. You see this little?
And it's going to go way to the top soon.
Those are her contractions. So we obviously weren't measuring them over here because I didn't put it on the right spot. Dr. Brock wasn't in there. Those helped me out. We've got one, and if I can see a timeline on here, 4 every 5 minutes we're going up. That's good, but they're not that intense. What you doing, honey? You got drunk you got high for the first time, eh?
First time in a long time.
Yeah. They gave you some meds to make you go. We are officially 0.5 centimeter dilated, yeah?
Yes.
And they put up a balloon up there, so.
It was so painful.
How you doing now, Chica?
Well, at first I declined the pain meds. Just because I thought I would have a high pain tolerance, but tattoos and Botox is way different than that thing. So I'm feeling much better now. I'm just like really dizzy.
Really dizzy.
We're making her bed.
Yes.
That's freaking
So
me
now-
out in a good way.
Yes, Christina's over here getting ready. If anything happens, mind my nice. Oh, look at that. Oi, oi, oi. So do we? When do you say you started labor? Not yet, right? When does labor start?
They're about 6, 7 weeks.
So baby mama's got some meds in her. Get some rest. We got a marathon in front of us, eh?
Yeah, it's gonna be a while. Her birthday will not be today, so Dad, you lost on the predictions.
Well, I can take that loss. All right, so the time is 8:10.
9:10. Take 3.
9:10, and it's PM. You can't tell because of this insane asylum we're in. No walls, no light, just us. Scheana has been a trooper. An hour after the balloon, and we have pulled her down. So the balloon was up, and then we got to pull it down a little bit more, which expanded her cervix. So we're doing good, sweetie. How you feeling, baby? Hey, baby. Mum's here, covering it, doing mum stuff.
Just mom stuff.
Just tickles.
Tickles.
Is that why? See, because this is why every night I have to give her tickles because of this.
Because of this.
All right, honey, let's go. Little doc cam update. It is. Let me read this clock. 10:27.
No.
What? 10:18.
10:18. Oh, what has gone
He's gonna
on?
blame that on his absence.
This world and myself are disappointed in myself. I can't read that.
It's an analog clock.
Dark.
Come on.
You got dark real quick. All right, but well done, honey. The balloon went.
Balloon came out.
Balloon just fell out.
All by
So
itself.
doc's coming in. We'll give you guys an update soon. But we have a trooper. Guess what, guys? It's all happening.
You want this pillow anywhere?
Drink bitches.
Where do you want it?
How you feeling, honey?
I feel 100% right now.
You nailed it. So as
Oh
we
my
said,
God, that balloon getting out, being able to go to the bathroom, and now just
well, hopefully the balloon stays out, right?
yeah, they don't put it back in.
No, they don't put it in.
Okay.
It's out.
Do they?
It's out. Yeah.
All right. Yeah. We interrupt my wicked tuna session with a baby update. So, honey, it is. Let me get this. I can do this. 11:48 p.m.
No.
10:48 p.m. I was close. And we are doing really, really well. Actually, too well. So they had to reduce the amount of stuff you were getting for Pitocin because she was meant to do up to 5.
Yeah.
No more than 5.
No more than 5 contractions in 10 minutes, and she was pushing number 6. So
And I don't feel them at all. It's great.
she's on the go-go juice. So she slowed that down. We have. Why am I trying to do this clockwork here? We have 1 hour and 10 minutes to get to the 26th and make it to the moon, the pink moon.
Yeah. And one of our friends'
Yes.
cars just broke.
Yes.
And they're gonna probably have the same birthday.
My boy Cap, watching up. Talk to you guys
Why do
soon.
you have your mask on?
Trying to keep everybody safe. How you feeling, honey?
Right now, I feel 100. It
What?
feels so good.
That's an answer. 100 to the millennials. You
What?
100.
Yeah, that's how I would text. If I was texting right now, I would just put the 100 emoji. That's how I'm feeling.
Middle-aged woman sending emojis and text messages.
Lady called you
She said, it's okay. You look good, honey.
Thanks.
You're doing great, baby.
Feeling great.
So I guess now we just got to monitor room 14 in your 10-minute cycle. 1, 2, you're at 3. Oh. Yeah, you're on 5 every 10 minutes, and you don't feel them.
Show the right one this time. You were showing the neighbors earlier.
Okay, sorry, doctor wasn't on point. Over here. So down here, this is intervals of 4 minutes. 4, 8, 4. 1, 2, 3, 4 minutes. There you go. So 1, 2. Let's count them out. All right, baby. Get some naps in ya until Doc comes in. We're gonna get some rest, and then Doc will be in here to check out the balloon pop, see what's going on down there. If the cervix come to play, who knows? Maybe this might be a little shorter time than we know. Maybe she's a superhuman woman over there, eh? See you guys soon.
Good deep breaths. Okay, I know this is counterintuitive. Relax as best you can. We are at 5.5 centimeters. That was a powerful clearance. You did great.
Goddamn meditation.
Exactly. That's truly where it all came from. So you're 5.5. Let's say she's like 5.5, maybe 70, and -1. Great.
My friend swears by this meditation.
Oh yeah, it's the
I know, it had
meditation.
nothing to do with
Nothing to do with the
that.
doctor's work at all.
She's like, have you done it yet? And
Yeah, you did all the work. We're simply here to just be present and observe it. So
Honey, you do you, baby. Woo!
I'm glad that I could give you some good news. Because
Yeah,
you're great.
thank
Okay? Yeah, of course.
So what does that mean now? Just put us on a different category.
Perfect question. So basically, you're kind of just on the edge of entering what we say like the active phase of labor. You're moving closer and closer to that 6 to 10 centimeters. Really, what we say at this point is we'll give you some time. We don't need to do any checks unless it's going to change our management right now. Just because always we're thinking about ways of limiting infection or anything like that. So really, at this point, just let us know how you're feeling. We're giving you that Pitocin. We can slowly kind of continue to go up and up as we see over time and see how your body is responding. And you just let us know how you're feeling. If your pain starts to increase, we can think about that epidural for you, and we can also check to see where you're at. So those are all things to keep in mind.
okay.
So, but in the meantime, just rest while you can, and we'll go from there.
Perfect.
Of course, that's wonderful. You're doing great.
Thanks.
Yeah.
So they're gonna look at your blood, check out your platelets, see what your liver's doing, making sure baby mama's good.
My water just broke.
You alright, baby?
I just peed
You scared
myself.
me when you did that. You didn't pee yourself. Your water broke.
Oh wow.
Look
Holy
at
shit.
what can I do for you, honey?
I was just about to get more fentanyl and then poof.
I think you already got it.
Oh,
No.
not yet.
So, at the risk of sounding stupid, the baby doesn't get any of this opioid in its system?
Oh my
They-
god.
They can get a little sleepy,
Love you,
but that's
baby.
it, and then they
Love
wake
you.
back up.
Alright, water broke. What do we do now?
Get rid of my nice blanket.
What do we do now?
Just like I knew you would.
Alright, baby. We are, this bloody analog clock's gonna get
I
me.
hear you. What time is it?
It is 11:52. Fucking that, look at that.
PM.
PM. Look at you go, honey. We have a water break. So, we're doing all the right things. Yes.
Just goes, oh my god.
Good
My water
work.
just broke.
Oh,
I haven't had that epidural yet, so I felt that. Ooh.
Now, because she just had the pain meds, is she still able to have an epidural when
Oh,
you
yeah.
get in?
Yes.
Yeah.
Call my trenchers.
Hey,
Hey,
Joanne.
Christina.
You good?
Uh,
Okay.
Hey, 14 at she wants to
you're doing so great.
So,
Your body knows what it wants to do.
Just relax, you relax. You gotta just focus and relax. Don't get
where do
worked
I
up.
keep babe?
Okay. Relax.
Would you?
I've been searching for this all my life. You're just my type. I've been looking for a boy who can treat me right. Your dark hair with those eyes so bright. They look into my soul and it sparks my life. Can I take you there? Like it was the first time. Do you remember? Can I take you there?